It's not just the fact that people need to go to conferences to, get their CEUs so that they can maintain their certification. The point is you're certified because you go the extra, and it's hard, and not everybody is willing to do that on your day off to go, to a conference, which is kind of like work. And, I think that, like it's been said before, so many people in ASU are certified because Joann pushed. She did. She would ask you why you didn't want to, and don't you want to, and you're, a great nurse. She was always telling people how great they were and made you feel like you would be more empowered by doing that.
Joann this is about you being the best nurse that you could possibly be, and to help a patient have the best possible experience, and the family to also have the best possible experience that they could have. And that's what we remember, and that's what we all live by.
And she gave me, personally, for me to call a physician and say, let's try Zofran. That was huge for me to be able to do that, because, a doctor's order is a doctor's order, and, you don't question the doctor, and, but Joni would be right there. You can do this. You can do this. And I think it happened to everybody, that pick up the phone and say, let's try this. And I think ASU nurses brought those surgeons and anesthesiologists on board as far as using Zofran.
One of the major things that I remember about Joni is when she walked into a cubicle to meet somebody, the first thing she'd do is go right to the bedside, extend her hand and say, welcome to ASU, my name's Joann Groff, I'll be your nurse today. So she wasn't back at the head of the bed being aloof and just looking through the chart. The first thing she did was greet the patient as a human being, which I thought, I'm going to do that. And no matter how busy, no matter how rushed, no matter what's going on down here, I'm going to do that.
She oriented me when I first started in ASU, and I could never believe the amount of compassion and enthusiasm. And Joann was the strongest advocate that I've really ever met in my life. She changed policy at Maine Medical Center, as Gail had said too, that she pioneered about medications, about techniques, about the importance of networking. She brought the state of Maine together. She was really pivotal in joining all of us from Bangor to Ellsworth to Southern Maine Medical Center. In her example, I think that we all live that still today, that, we do feel that it's important to our patients and their families and the institution. I mean, Joann was a star, a diamond in the rough at Maine Medical Center, and she lives on. We see her picture every day, and we still live by what we learned from her, and her enthusiasm and spirit are still there today. Joann also went beyond the traditional. She was fully aware of the importance of the mind-body connection in healing. Recognizing anxiety's negative effect on the desired patient outcome, Joann began studying the alternative healing arts. She became a master at Reiki and hypnotherapy. Much to the amazement of her peers, she used these skills regularly to successfully reduce the anxiety of some of the most out-of-control preoperative patients, some of whom were literally scared witless. Several of these individuals would never have had their sometimes life-threatening procedures had it not been for Joann. Her unique and astonishingly effective approach for meeting the emotional needs of our patients inspired her peers to nominate Joann for a prestigious national award. In 2002, Joann Groff became the very first recipient of the American Society of Perianesthesia Patient Advocacy Award.
Barely a day went by that Joann wasn't promoting the latest nursing conference, organizing an in-service, or simply sharing the latest healthcare information at the nurses' station. She also shared important healthcare tips directly with patients at the bedside. Joann took her belief in and passion for education to the next levels as a board member and later as president of the Maine Society of Perianesthesia Nurses. She also became a board member and regional director for the American Society of Perianesthesia Nurses.
Education and advocacy aside, what really stood out about Joann was her sincerity, her compassion, and her amazing, cheerful, and positive energy. These innate characteristics and her relentless pursuit of the best for her patients and her profession made Joann Groff one of a kind. We miss her still. The Joann Groff Patient Advocacy Foundation believes Joann's efforts will not be forgotten, and we will continue to promote her vision of better patient care through research-based, traditional, and holistic nursing education.
We welcome you to the annual Joann Groff Perioperative Symposium.